As the coronavirus pandemic rapidly sweeps across the world, NIMT has been focusing on research and technological developments that will be important to the world and will play a role in preparing to deal with those emerging infectious diseases and support countries' public health work in the context of Thailand.
Project overall. The overall picture of this project is to verify the readiness of PPE suits by a non-destructive method using air prior to staff in healthcare facilities use them in their daily obligations. The test method is by using pressure and flow rate of air to determine the readiness of the PPE suit. Under test by compare its pressure and flow rate during the test to the collected data of PPE suits used as standard reference. Benefit to APMP members. After the project has been finished, NIMT is willing to transfer this technology to every member who interested in this project. This can be done by online workshop. In addition to that, all necessary files and drawings could be sent via email. The status of this project is at the research stage of finding the most suitable air flow rate and air pressure. Unfortunately, during the past months, NIMT implemented the policy of 100% work from home for safety of its staff and community that indeed detains the project progress.
In order to help provide personal protective equipment or PPE for the COVID-19 pandemics, NIMT proposed a project of creating and testing a 3D printable power air purifying respirators or PAPR to APMP. The aim is to release it as open source. We have finished all the preliminary and the detailed design. We are now ready to fabricate the first prototype using a 3D printer. The PAPR will be tested after finishing the fabrications of a prototype. The open source files are expected to be launched in a website at the end of the year.
Given the impact of the global SARS-CoV-2, or we know as COVID-19 pandemic, National Institute of Metrology around the world have recognized the importance of standardizing the measurement SARS-CoV-2. In a very important circumstance, the Institute of Metrology by NIMT China, NBSIC LGC UK has provided an international laboratory comparison of the CCQM P199B SARS-CoV-2 RNA copy number quantification. National Institute of Metrology around the world have participated in these comparisons, including us, bioanalysis group at NIMT. We participated this comparison at the end of last year. We show our capability of SARS-CoV-2 RNA copy number quantification with digital PCR using reverse transcriptase polymerase chain reaction technique. The next project of bioanalysis group at NIMT is to produce reference materials SARS-CoV-2 to standardize the measurements of SARS-CoV-2 for testing laboratory in Thailand. We expect that this reference material will help and support laboratory testing for SARS-CoV-2 in Thailand to be able to access their measurement method to be more precise and accurate.
As the situation of COVID-19 pandemic, clinical thermometers are widely used to screen people, including skin infrared thermometers and thermal imagers. The accuracy of the thermometers should be verified by comparing of its reading with a standard blackbody source, which its uncertainty should not more than 70 millikelvin. At NIMT, we design and manufacture a possible standard blackbody sources with high emissivity at 0.999 and its uncertainty below 40 millikelvin. We use the standard blackbody sources to verify the thermometers from hospitals and also distribute or sell them to secondary calibration laboratories in Thailand. So we use metrology to improve health for the better life.
The ventilator is one of the most important medical devices used in the treatment of patients of COVID-19. However, although the ventilator is beneficial for the treatment of patients, but there are risks that need to be careful. In particular, measurements such as pressure and flow rates used in the ventilator system must be accurate in accordance with accuracy of the ventilator. For this reason, the NIMT is aware of transferring the accuracy values to the standard equipment used to calibrate ventilators in order to reduce the risk of patients and give user confidence in their use. Currently, the NIMT has the capability to calibrate the ventilator tester pressure and flow with traceability to its primary standards. Pressure traceability through the pressure calibrator and to the pressure balance, which is the primary standard of pressure which maintained by pressure and vacuum laboratory. While flow traceability through the LFE sonic nozzle and to the piston and bell prover, the primary standard in flow which maintained by flow laboratory.
The performance tests of infusion pump include of flow rate accuracy, volume accuracy, and occlusion pressure. There are two main performance tests of infusion pumps, flow rate and pressure. The analyzer will provide the flow rate measurement accuracy at 1% of reading. Since that, the calibration facility CMC has to be designed for less than 0.33% of reading. In other words, 1/3 of accuracy. That's the rule of thumb. The weighing method is selected as the main equipment for the facility and also equipped with timing acquisition system. NIMT has 3 weighing balances, 0.01 mg, 0.1 mg, and 1 mg resolution. The shield that covers the balance is used for controlling humidity and disturbance that would affect the balance performances. The pressurized and degassed RO water, DI water is also recommended, are used as the medium in the measurement. With buoyancy corrections and other parameters have been calculated to get the mass flow rate measurement. Then the volumetric flow rate can be achieved by using the water density as another parameter. This facility can perform the flow rate measurement ranging from 10 to 1000 milliliter per hour with 0.24 to 0.35% CMC. The pressure calibration can be calibrated by follow the pressure calibration standard DKD R6-1 frequency. Since the facility has been established, NIMT has calibrated the infusion device analyzers to both private and public sectors for around 7 to 8 units in total. Not only the analyzer can be calibrated with this facility, the high accuracy meters can be also measured.
NIMT has implemented the NQI to build up standard for herbal medicine production involving the whole value chain of production. Start with farthalazone, which has potential for treatment of COVID-19. NIMT supports farmers to manage their farm meet GAP standard and also for manufacturers meet GMP standard. In addition, NIMT collaborates with research institutes to produce CRM for bioactive compounds, pinostrobin in finger root extract, which have potential for treatment of COVID-19 and other viral infections. This implementation of NQI in farthalazone projects can be applied to other herbal medicine, for example, finger root, for ensuring the quality of product from farm to market shelf. This project can be shown how to build up the whole chain of metrological traceability via CRM and validated method of measurement.
Moreover, NIMT, in cooperation with Department of Health Service Support and Department of Medical Science, have prepared a manual for testing procedures for medical measuring devices to help improve and develop the quality of medical measuring devices and build people's confidence in medical measuring devices to international standards. In addition, we also provide free of charge, non-contact infrared thermometer calibration service for hospitals and public service units in order to strengthen their confidence in the use of thermometers for users as well as to build confidence for the people in the country.